This is Because Teeth Podcast with Greg Santiago and Cody Preble. All right, another episode.
We are back with episode G.
Episode G today. So today is a good topic. It kind of ties in off the last episode. So we're going to kind of hopefully keep the series going, keep the episodes flowing. And the topic for today is going to be strength and weaknesses, I guess, when it comes to classes in the program, but also kind of correlating it to boards. So what is our strength and weaknesses studying for boards? So
like the time we're allocating for each.
That too. I mean, I haven't gotten that far into it. I'm more
well, but if it's a tougher class for us, then we're going to allocate more. And
yeah, exactly. Yeah,
it ties in hand in hand
for sure. It's important to acknowledge it and know what your strengths and weaknesses is and are, so that way you can, like you said, put more work into
and also
that.
We're talking about this because we're getting ready to go to our board review.
Correct. So we got our first, well, I guess it's our only board review.
Yeah, our only one, yep.
We got a board review that we're going to be, when this episode airs, we'll actually be at the board review. So we'll be going through getting a lot of knowledge bombarded, with a lot of information.
Yep.
So that'll be fun. I'm actually really excited, and I've been studying a little bit over break, not in depthly, just because we are going to have a lot of information, and I think they're going to give us kind of the roadmap to really be successful.
So I tried to do what I could, but I think that's going to be my main thing is going to that thing and
focusing after that.
Correct.
Yeah,
yes.
they'll give us the keys to success.
Yeah,
that's what we're hoping for.
Yeah, I'm hoping they lay it out better than I have done for myself so far.
Yeah, they'll have the treasure in the treasure chest. So we're hoping to bring it home. That's the
what
plan.
we need.
So so we're going to a board review. We're going together, actually, obviously. So that'll be fun too. We'll get to have some, I guess, a little bit of fun in a way, but also focus. And it's all day. It's 3 days.
Yep.
Back to back. Different subjects every day, different hour, different subject. And just from, obviously I downloaded the app that's correlated with the seminar that we're going to. And I've watched some of the videos like I was talking to you earlier about. And it looks like it's about 2 hours, give or take, depending the subject, because not every subject is, some of them are longer than that, actually. Yeah. But some of the give or take, hour and a half, 2 hours, 2.5 hours each subject. So
okay.
I don't know if you're aware of that. So
no,
just
I didn't
so you know
that.
So I mean, we'll get that once we get all of our what we're going to be
give
doing.
us the schedule and everything.
Exactly. So I'm excited, and let's just dive into the episode. My classic. I'm sinking in, diving.
There we go. Let's sink into the new episode.
We'll sink into change it up today. So. I guess I'll just start it off and kind of lay out my strength and weaknesses. I know I'll definitely start with my weakness is pharmacology. I think I've said that in one of the other episodes. And for me, I would say that pharmacology is probably my weakest point or class. Is one, because it's kind of straight memorization. It's not like you can look at something, touch something, and kind of feel and put a picture to it. It's just memorize, this class of drugs with this ending. And for me, I don't have the best memory strategies or the best memory. So that has been very hard for me. I think there's different ways that we've learned, and we were blessed with our teacher.
Yeah.
That she was really, really good. She laid it all out for us in chronological order. Started with obviously basics and worked our way and made sure we grasped the topics, but it's just a lot of information. It's hard. It's memory. It's so many different, and there's new ones, there's old ones, and how to distinguish. It's a lot. So.
And it's not really like the rest of the classes. Like that's in its own category. There's not really anything else that's
very
similar to that.
Yeah, you're right. It's got its own part. Like it's like it's funny because like. It was, for me, I was excited for it in a way, like get to really learn because, just like our teachers, said during, our class, like you get to learn what your family's taking. You ask them, now you can help them guide their even dosage, that kind of stuff. It really helps you overall in life as well, not just, obviously we got to know it for boards. We got to know it for practicing and recognizing so what we can, kind of understand what the patients are taking for medical history and help them if we're giving them any type of, dental related prescription through the doctor, obviously not us particularly, but through the doctor. So it's very important, but it's just, personally, I was intrigued for the outside perspective of it as well. And then we got there and it was like, wow, like this is going to be a fun class at first. And then we started going and it was like, it was a lot.
Yeah, that's what I was going to say too. I found it very interesting, that whole side of it that you said, but it was just a lot. There's just a ton of information. Like I remember our binder at the end of that thing was just super
Filled.
thick.
Yeah, filled to the T. But like we said, that binder that we were, fortunate that she, blessed us with, that, all the organization of the PowerPoints and all the prescriptions, the way she had her PowerPoints laid out, it was very, very good. So definitely had to bust that out. I think I told you over break, I was like, yep, busting out our binder, so.
But I'm curious how much of that, like when we do go to the board review, how much of all that we learned is actually going to be stuff that we're likely to see on boards. Like, do you think we're going to need to know it that in depth? Because when I was looking at like the guides and stuff from previous years, there's only 20 or so questions in pharm. So, I mean, yeah, it's going to be good to know all of this for clinical experience as well, but for the test, I don't know how much of it we will actually see. I know it varies every year. We'll have to wait until the guide comes out for this year.
Exactly. I was going to say, what guides were you referring to? Now I know what you're talking about.
Yeah.
So
I forgot the name of it. It's like an abbreviation, but I just looked it up. Like,
yeah, like it says, breaks down like what.
It has how many, so many questions are coming from this class, so many from this, and gives you an idea of what you're going to see.
Yeah, so the pharmacology definitely my biggest weakness, and it's the memory for me. I know people that great photographic memory. They say one thing, yep, I know, OLL means I couldn't even tell you right now.
Beta blocker.
I was gonna say beta blocker. What was I gonna say? I was gonna say something like beta blockers. Barbiturates? No. That's what I was gonna say.
Oh, you're going to get barbiturates.
Yeah,
we were talking about that, yeah. That's the other thing, is that it's so easy to mix up things like
it is.
The lambs, the Pams, the
lambs.
There's a whole bunch.
It is. And that's, for me, that's just, I can't grasp that.
Yeah, it's a lot to get straight.
As much as I try. And I know one thing that, our teacher recommended was, having like different rooms or different places you study.
That was a good tip.
Parts of the pharmacology, study your, antihistamines in your bathroom,
one area,
or, that kind of thing. So I tried that. I didn't correlate it. I wasn't able to.
Okay.
And I think it was just because you're focusing on that. For me, I was focusing on the information that I wasn't like looking around, observing my bathroom.
Well, I don't think it was so much like taking in where you are. It's just like, because then when you go back to think of it for a test, you're like, it's just another way to like trick your brain. Like instead of remembering just the endings, you're remembering, oh, I was in this place when I was remembering that. So then it kind of tied it to it.
Yeah. I think it's just, and it's funny because like I said, I was really excited for pharmacology. And then when I really got into it and realized how much we needed to know, I think I kind of like shut down a little bit, to be honest with you, that it was a little bit of a mental block. And I think some of that was like unconsciously being done. Like I was like, I just got to learn all of this, and actually for our final, I actually made like poster boards. So I made poster boards and put, certain, class, drugs with certain, poster boards. And I tried to do it with colors as well. And I put it on the wall. I literally had like 6 different ones. And the colors helped me, believe it or not, just because I'm a visual hands-on learner. So the colors helped me a bit. But yeah, so that's definitely my weakness. I'm going to say strength. I would just say like probably like dental materials and dental, maybe not anatomy, but probably dental materials and preventative, just because I have the experience from, not that all of it. I mean, obviously we went into detail about, the certain toothpastes and different methods. I mean, I definitely didn't know every single method going into preventative, but I did know certain things like angling it at the gum line, certain motions, the circular motion, how long. I did understand a good portion of that just from the assisting experience and in teaching, and assisting. So I would say dental materials and preventative was probably my 2 strengths when it came to classes. So I
just
don't really have to
because you were a little more
review.
familiar with them.
Yeah, I mean, I've been, I was an assistant for a couple of years.
Yeah.
And so I think a lot of that.
I enjoyed materials actually, kind of more than I thought I was.
Yeah.
To me, that class was more like kind of like a ceramics. At least the lab was.
Yeah.
And then it just, whenever I apply things hands-on like that, it just makes learning it so much easier, and it just sticks a lot better for me. So then with the lab, I really enjoyed it was just
The material.
Yeah.
Yeah.
It made it sink in
Would
better.
you classify yourself as a hands-on learner or no? Because I would.
Well, what really consists, like, what does it take to be a hands-on learner?
I mean, I don't.
Just
I
like
couldn't
on the
tell you
job,
exactly.
like on the job, like.
Well, just what you just said. Like you said, you enjoy the material because you're applying it.
Okay.
So applying it is. I mean, there's a difference there, obviously, but. So I mean,
I guess so. Then
I would say you're definitely a partial hands-on learner because you're a lot better at memorizing, I would say, than I am for sure. So I don't know, but I just wanted to ask. I didn't know if you knew because obviously there's different tests that you can take to see what you fall under.
I always start overthinking the questions too much and like trying to plan out like how I'm going to answer the question based on the result that I want, and I don't take them just.
I got you.
But remember in Pharm when we actually took that?
Yeah, that's why I asked. I was like, maybe you remember or.
Yeah, I don't remember what my learning style was.
Yeah. Well, so what you're talking about, just so listeners know, when we started pharmacology, I think it was our first day. Our teacher presented us with basically a I guess you can maybe not diagnose it, but diagnostic tool to see what kind of learner you are. And it asked certain questions. I think there was even some type of pictures that were drawn or something like that.
Yeah, we did the picture
that we
with
had
after,
to draw
I think.
and what it meant. And what you drew meant what kind of learner or how you applied that information you just read. So that kind of distinguished what kind of learner. And I think that is important. I mean, obviously for pharmacology, because she knew that so how to study your material. So.
Because maybe that's why that whole learning in a different area wasn't really your thing because that just wasn't a part of your style.
Yeah, exactly. So, yeah, well, let's hear your weakest class, or you want to start with your most fun class?
No, let's start with the weakest.
Okay.
I think for me, my weakest was probably oral path.
Okay.
Just because the whole breaking down and I don't know, I never, like in class we were presented with the... What would you call those? Like when someone has something, just
different pathologies.
Yeah. Different pathologies, but I don't think we really went into too much of like the beginnings and endings. Like I probably should have looked at that a little more on my own.
Yeah, I would say we didn't spend a lot of time on that. Like specifically, like it was definitely presented to us.
Yeah.
And you know what's so funny? Because I mean, obviously I say like, I'm not a good memorization, but I remember those. But with that, you almost you have a picture to correlate with.
Correct.
So I'm a visual hands-on learner. So seeing those pictures and with the endings, I'm like, yeah, I know what an OMA is. It's, it's a benign tumor, so those are the kind of things like I remember that. So
yeah, see, I just couldn't get that straight in my head. And I felt like all the words were kind of similar after a while to me. And
a lot of omas.
That's what I think. I just need to take my time and separate all of that really for studying for boards and stuff. And so many of the lesions look the same or the characteristics aren't too far off. Like it'll just be, oh, this one's a little red. No, this one's a little pink and white. And now it's a whole different thing.
Yeah.
So there was just a lot to that for me.
Well, for me, I definitely have mentioned this, to you in class personally, that a lot of the pictures are hard to depict it, and I know for sure, and we've talked about it, in other classes, not just oral path, but that on boards, the pictures aren't the best. And it's like, you would think like, no, these are the best. This is the best kind of picture.
I mean,
you
they
can
should
get
be
to
with the
describe
technology
this.
we've got nowadays, you would think.
I mean, but you know what though, honestly, not for nothing, and I don't know if this is maybe why, but when you're visualizing it, I mean, when you're actually, with a patient and you're looking at, a pathology that you're not going to have a picture perfect.
That's true.
And every person differs. So even though, let's say a herpetic lesion, it looks a certain way, I mean, it's going to always look a certain way. But I feel like it could vary a little bit or be similar or size. You're never going to have that picture perfect
the same
every single
version
time.
of it, yeah.
Exactly, but that's the beauty in oral pathology. And that's, for me, I like that because it's like it never gets boring.
Yeah.
Like that, I personally obviously enjoyed, pathology a bit. I wouldn't say it was my best subject, but I was very interested in all of the, different things. And I think that also kind of touches with me, like with the the perio background, like working in a perio office and seeing, I mean, we didn't see a lot of like herpetic lesions or anything, but, you know, obviously a lot of like dry sockets or, you know, different tumors or cysts or periapical cysts, you know, just a lot of different, you know, basic kind of, you know, pathologies that we saw on a daily basis. And I like that because they are different. They're different sizes. People, you know, some people have different, you know, symptoms of them and stuff like that. And I just thought it was really cool. And one thing that I always like to talk about, like when it came to like the perio side of it, is it's always cool. And I think it is sometimes like even a mind thing that even when it comes to like some type of surgery, if you have like an infection, I mean, really what it comes down to, no matter what the pathology is, well, I mean, obviously it matters, but a lot of infections, when they're cured or removed or that nature, it's kind of cool how it correlates with, you know, different parts of the body or things like that. I mean, I think sometimes it's a mind game. It's like, you know, the patient like thinks like, oh yeah, you know, like finally got that tooth that's been, you know, hurting for 2 or 3 years, you know, taken out, and now my knee's feeling better. And, you know, I don't think there's any direct correlation. It's just kind of like a mind game. I mean, I'm sure there's some type of science that links certain things, and I know there is. I don't know the specifics about every single one of them, but I think it is interesting, you know, that it's kind of cool how it can be correlated, you know, sometimes. So I would say that oral pathology and periodontology are probably my favorite. I wouldn't say they were my strength, but they were my favorite. And I liked, you know, just all of the, you know, attachment when it came, you know, periodontal, like recognizing recession and that kind of stuff. Like, I like that. Like, I don't know why, but I think I've told this. I don't think I've said it on the podcast, but I definitely want to like work in a perio office. So.
Yeah. No, I think you did. You mentioned that in one of the other ones. Yeah.
Okay. Yeah.
I don't remember which it was, but I know you did mention it at one point.
I definitely want
Wait, what did you say your strength was?
I would say like preventative and
materials.
And
materials. Okay. That's right.
Yeah. I mean, just, I guess from prior, you know, information.
Yeah. But then your favorite is oral path.
What's your favorite?
Well, let's go strength first.
Okay, let's go strength.
Maybe it's not my strength then. Okay. So my favorite, I think, probably is radiology.
Yeah?
Like, I just enjoyed that class. And now thinking about it again, because it was a hands-on one, I enjoyed it. And that was so much different. Like, that class was just very interesting to me because I didn't really know much about how x-rays or anything were taken, just not even like for your teeth, but just regular x-rays. And learning about all that and seeing how it was done. And that class was very cool to me. I enjoyed that probably the most. I don't know if it's necessarily my strength, but that's why I say it's probably one of my favorites because I really enjoyed that.
Well, I think a big part of studying for boards and, you know, learning, you know, outside of, you know, just studying for just the boards, but, you know, us becoming, you know, clinicians and being, you know, specializing in certain things and finding those things that we really like, using it, let's take it back to studying, I guess, you know, for boards that even though they're our favorites, we want to study them the hardest because we like them. You know, do we need to maybe spend so much time? No, it's not our weakness, but that's why it's kind of hard to distinguish because like, even for me, I'm like, yes, let's go to perio every time. Like I want to go right in there and I want to learn it, but I shouldn't spend a lot of time doing it because not that I know it all, but I like it. So I know that material will come easier. Yeah. You know, that when I'm learning it, that it'll be
like,
easier.
I remember you saying when you were going to sit down for pharm, it was going to be like, all right, here we go. And then just sit down and you knew you had to get yourself prepared because it was going to be a lot for that one.
Correct. Got to mentally disconnect from everything else that's going on. And I guess that's a good point too, to kind of talk about is I know for me, like, not obviously studying, 8 hours a day, during break, just a little bit here and there in a sense. But most importantly is like having those extracurricular things going on and being able to disconnect to really absorb that information. And I think that's also why you bring up the whole fact that you haven't really studied too much because you're really waiting till this, but you're mentally preparing yourself to this to switch gears. And I think that's a big thing to acknowledge. And I think everyone should kind of have that balance of it, that they should be able to, whether it's, you have kids, you gotta, let your kids know or, plan for certain days of the week that you're gonna, allocate the time to study for those, certain subjects or, whatever you're doing. I think that's a very important thing to disconnect. Like, I know this is really stupid, but like for me, I always like to work out, and I like to work out very early in the morning. And sometimes I have to hit a second workout to really just kind of get everything out. And then now I can disconnect, sit down, focus, and study and absorb, but I think everyone has, their certain way of how they do that. And I think it's interesting.
Yeah, and you need to do that. Otherwise, when you do go to sit down and study, that study session might not be as valuable to you. It might just be like, okay, you were there and you sat down and read it all for 2 hours, but what did you actually take in? Because you weren't in the right mindset or you weren't feeling the right way. So I agree with that as well. That is a very important part of it.
Yeah, I think it's part of the process of acknowledging the strengths and weaknesses of your subject, so you know how much time to. And then when you're going into that subject, okay, you need to dedicate a little bit harder, maybe allocate more time, whatever it is, because it's not always just about time. And I think that gets misconstrued. I don't know if that's even a word. I think I made that up. But
misconstrued, that's right. Yeah.
Is it a word?
Yeah.
Okay, I felt like I was coming up with a little word. I know I've heard something like that, but is finding your recipe to your success. That everyone wants to study 24 hours a day. I mean, maybe not. I don't think anybody wants to study 24 hours, but that's your kind of mindset. Like, no, I got to study. I got to study. I got to study. I got to study more. I got to study a little bit more. No, I got to study even more. It's not always about that. Finding your balance, getting your mental, I guess I'll say stability of disconnecting, plugging it in, and making it work.
Yeah.
I think that's a very big key of it. And it's funny too that I'm kind of bringing this full circle about, finding those subjects that are favorites that we like, because there's time that I get discouraged. Like for me, like with pharmacology or even radiology, I've grown to love radiology, like secretly. But when I'm having those difficulties, I'm like, okay, I'm done for the day. Tomorrow or the next day when I go back to studying, I'm going to actually study what I want to learn and get me back in. And now I'll take a hard one after that. Does that make sense?
Then you kind of like ease your way back in a little?
Yeah, like it's like, okay, like, no, I got this down, or maybe some stuff that I've previously studied. Let me just review tomorrow. Let me take a break. This is too much. I'm not grasping at this point. So let me review at this point. I think is maybe more of what I want to say. Cause there's days that I'm just reviewing. I'm testing myself.
Yeah.
I think a lot of the times is we have a lot of different questions and it's just questioning. And those are the days that I disconnect. So it's studying and then reviewing.
That's something that I would be interested to try for myself, because I haven't really done that. I feel like once I start something, I'm like, oh, I just got to power through the rest of this subject before I move on or whatever. Or I already have a set path and I don't really stray too far from that path that I set for myself. So doing that is something that I would try. I'm open to try like any of these tips that I hear, because it's like, why not? What do you have to lose trying a new tip?
Well, that's why I think it's great that, we're talking about this. Is a good episode, because a lot of people sometimes don't even know where to start. And I think that was a little bit for me. And I knew, just from talking from other people, is one, obviously learning your the way that you learn first and foremost, then coming up with a schedule, allocating that time to that schedule. And for me, it's been like just basically subjects a day. So I'll pick certain subjects a day. And then I go back, and once, like, for example, like yesterday, I studied nutrition. So today, if I get frustrated, I'll say, you know what, I'm going to review a little bit of what I did yesterday, and then I'll call it a day. I wouldn't say that I'm always, I know it might sound like I'm kind of like, what's the word? Like putting like a lot of like twisting up the material by doing that, but I'm not, because I learned it yesterday. I absorbed it. I grasped it. I'm good. Today, I'm getting a little frustrated. I'm not getting it today. Let me just review what I did yesterday, and then I'll keep moving.
And that's what I was going to say. Do you think there's any classes that you could like pair together? Have you tried studying like 2 classes at a time? Like, oh, these 2 are kind of similar. Let me study this. And then, I'm going to study this on the same day to try and keep them related. Because in our classes, we have seen a lot of overlap, like in the material that you're learning.
Yeah, definitely. I mean, yeah, like just the material, the classes, they tie in together. So I have not personally done that, but I think I'm doing it unconsciously, because in some of those subjects, those other subjects are in them. You don't realize it, but they are, and what can bring it back, because our boards are not just the classes that we take in the program. I mean, obviously they are, but they're also our prereqs that we get, questions like I said earlier, nutrition is one of them. But linking some of those, like you said, would be a great benefactor, but some of those come into certain play to certain classes.
Correct.
So I don't know, like what would be an example like?
I mean, I guess even with nutrition, I was trying to think, because even nutrition in, I guess you could say preventive.
Yeah, exactly.
Those all tie in.
Correct. Like the different, what's the word I want to say? Like the different, not compounds. Just the different components of like the toothpaste, or the different components of whatever it is that we're learning preventative, whether it's, the diet, that plays a factor of what toothpaste you're going to give them. That kind of stuff correlates. You got to learn and kind of, I guess it's funny, I'm going to say this, like building on that too. Same thing with the classes. They build on each other.
Correct.
So not only are they kind of the same material, back to back, as far as like in one class you're learning and it's correlating with this class, but it's also like, 3 semesters ago you learned, nutrition, and now we're applying it in preventative.
Yep.
So you're building on that knowledge.
Or like back in micro, I remember when we first were learning about the like strep mutans and stuff, when we did like those base plate slides. Streptococcus mutans, yeah.
I had to say that one. That's fun.
And then seeing that again in perio, I was like, I never thought I would hear about those things that I learned about in micro again, or those little test samples we learned about. And then here it is in perio, and that's all we're learning. And then that correlates over with other stuff. It's just, you see it all so much.
Yeah, it is. Well, I remember, it's funny you're saying this, I'm remembering my micro and how we used like the blood auger or the augers to grow the bacteria. And then, come full circle a couple of years later, now we're learning the gram stains, what the bacteria is in the plaque or the biofilm. And it's just building off of it. And it's the same material. I mean, it's not the same material. It's just building,
And now you see why. Hey, this is why this is a prereq to what I'm in now. At the time, you think, I'm never going to need this. Yep. We don't learn about this in hygiene school. Like, what's the point? And now it's like, oh, okay. Maybe I should have paid a little more attention back then.
Yeah, well, just like you said, how much do you have to go into detail? So
exactly, yeah.
They give you the basics, and then now you're going into the specifics in a way. And you're going to get tested on some of those basics. I think we always talk, we joke about the angular cheilitis.
I don't even know if that's how we say it, right? But that's how we say it.
We always joke about that one.
That goes along with the nutrition.
Yeah, exactly. So there's so many like correlations with the classes that some of those sub-subjects, like I want to say you're studying the highest level of it in a way that those other smaller subjects kind of go in them. I mean, you're still going to study nutrition, I keep using nutrition, but whatever it is, whether it's, anatomy and physiology, that's going to be built into your dental anatomy. That's really what they're going to focus on, as far as like your studying and your board review. But you do have to know basics of, the capillaries and the arteries, and you still got to know those basics. But do you need to know all the muscles and the thigh,
tendons, and
do you need to know all of that?
And
obviously we would like to. I'm sure there's some very intelligent people that can remember all of that. I personally cannot. I'm not going to sit here and attempt to tell you, the tendon that's in your hamstring, or anything like that, because my focus is, working on the mouth and everything around the head and neck area, you know? So, but that doesn't mean I don't understand the muscle, tissue and, the correlation of the capillaries and the veins and the arteries. I understand that. And that's the basics. Like you were saying, you're building off that.
Yep.
So I think that's a good way to understand it. I feel like we kind of broke it down a little bit and kind of put it all together at the end by building on everything. And same thing with studying is building on one thing, getting that down, moving on, and then you'll back kind of track within while you're building.
And that's why I'm interested to see if that's their plan that they take at the board review. Are they going to start back at the prereqs and kind of go from there? Like we're going to start, all right, all the way back at micro, A and P, and then just build as the semesters went on, or are they going to try and tie them together? So that's why I didn't really want to jump right into studying. I kind of wanted to see their plan on it and how they thought, hey, this is the way that we've been doing it and it's been successful. So if that's the way, I would be interested in trying it that way.
Well, one thing that I do want to say is too, and I think it would sound like this to anybody, as an outsider listening to the podcast and listening to you talking about it, is that you are putting kind of also all your eggs in that hat too, which, not to say that it's a bad thing. And we're obviously, we chose this seminar for a reason that we're going to, but there is multiple seminars that people go to and they choose certain ones for certain things. I think we're probably save a little bit more information about the specific seminar we're going to for probably a future episode. But, one thing is that you're going off of that, which can be a good thing and it can be a bad thing. Yeah. And I don't, like I said, I think we chose a very good one that it is going to help us. I mean, it's got obviously good, previous history of reviews of people being successful. So I don't think, I don't want to shoot you down, but I want people to understand, because they're going to listen and they're going to be like, well, listen, you're going off of what you're going to. I hope that works. Yeah. It might not, as far as you're going to pass. But, I'm just saying, maybe when you go there, you're like, I don't like this, or maybe you're going to take one little tidbit. And that's what really, for me, that's, how I always say it, is that you never stop learning. No matter how skilled somebody is, how knowledgeable somebody is, you can always learn somebody from somebody else, and every day is a new learning experience, whether it's something small, something big, whatever it is. And I think for me, some of those, some of the different seminars, they have different strategies, so I think a lot of them are probably similar. I mean, I can't see it being too far off. Because in the end, honestly, it's all the same material that we already have. They're not presenting us any new information that we haven't learned in our program. They're just putting their spin on it and telling you the way that they've taught it or retaught it or reviewed it, or highlighting the most important parts of those classes. But it's all the same material. Correct. But that's why I wanted to say that too, because, I'm interested exactly what you said. I'm going to bring it back full circle. What you said beginning about it is I'm very interested to see the process of how they go through them. What classes do they start with? And I don't mean necessarily just prereqs and going back kind of our mentality of the beginning. Yeah. But maybe there's a correlation of them starting, let's say something like radiology. Why would they start with radiology and end with microbiology? Yeah. So I want to say that that's something to consider. Maybe they start with something hard and something easier. Maybe start with something easier and with something hard. Yeah. So I think that's going to be something we'll talk about on one of the future episodes. That we saw. The approach of how they went through it and how they executed and how we felt after. Yeah, because I'm sure they definitely put some thought in behind of how that. Yeah. So, and we plan also to record an actual episode while we're at the seminar. So we're hoping, that we can maybe get a guest on there as well. That'd be cool. So, but at the very least, we're going to do an episode at the end of the seminar, because just literally while we're there, kind of all of our feelings about it, kind of talk a little bit more about it. And, that'll be a future episode. Yeah. So I want to put that out there. And I guess we've talked about a lot today, so let's go ahead and go into our segment today. Today's Cody's word of the day. I'm not going to say word of the day. Cody's dental terms 102. That's correct. So, let's get this going right before board review. So let's see what you got today. Here's a pre-board review. Dental terms 102. All right. So I've kind of got two terms. They kind of go hand in hand. I always got them mixed up. So that's why I'm bringing them to you. All right. So I guess I'll just present the first and then you can go from there. Let's do it. So it is filiform papilla. Filiform papilla. I don't even know if I can spell that, and I'm just kidding. Is it papilla or papillae? It's spelled papillae. But it's papilla. But you know what's funny is that I want to say there might be a distinguished... There's a difference. There's a difference. I think so too. I want to say there's a difference for sure. And I want to say it even has to do with the way that you are, I'm not going to say describe it, but the way that you classify it and when you learn it. Okay. That's what I want to say. You learn papillae in a certain class and you learn papilla in another class. If I'm not mistaken. I think you're right. So yeah, you got me on that one, dude. So what is it? No. How about fungiform papilla? Fungiform. I mean, I know
That's the other one, because those two I always got mixed up. Fungiform and filiform.
I mean, it's pretty straightforward. It's some type of fungus, obviously.
It's on the tongue.
Okay. Both of them?
They're both on the tongue. They both have to do with like, not taste buds, but what's the word I'm looking for? It is a papilla. Let me just tell you the definition here. So the filiform is the most common papillae. Papillae. Oh, that's just a singular. Singular and plural. Yes.
Okay.
It's the most common papillae are small, round, and they're the ones that don't contain taste buds. Are the filiform. Filiform do not contain taste buds.
Okay, so say fungiform one more time.
Fungiform, I didn't say it.
Okay.
So these ones are found at the tip of your tongue. Those are the mushroom-like shaped, and they consist of taste buds and sensory cells.
Okay, so fungus turns into mushrooms. That's
fungus like a mushroom. There you go. Yeah, that's a good way. So fungiform is mushroom shaped on the tip. You taste mushrooms as well.
Okay. Yeah, true. Okay, I got it.
Taste buds, and then filiform, they are do not contain taste buds, and I want to say those ones are located in the back of the tongue.
I mean, it's definitely the dorsal, but
yeah,
I don't know if it's gonna be the back. It's probably gonna be like the middle. I guess you would say and
then there's what are the other ones? There's the V shape. There's a whole bunch of papilla on the tongue, but what are the V shaped? Is the circumvallate papilla? How do you say that one?
Circumvallate.
That's the V. They're in a V shape on your tongue. I remember that one. I just can't pronounce half of the words.
See, look, you said oral path is your.
But is that oral path or is that dental anatomy?
Probably both.
They overlap.
Yeah, there you go.
So, the gist of today. The subjects overlapped. And you're going to see things in more than one.
All right. That was a good one. I like that one. See, honestly, I wish hopefully when we start doing the YouTube videos, actual videos, that we'll be able to like kind of insert like maybe like some pictures of some stuff that we'll kind of present, or maybe even like in front of us. Like we'll pull up,
that'd be cool.
Video, kind of almost like a case. So maybe that's what we'll kind of work towards. No, we won't do a whole case, unless they want us to. I mean, if y'all want us to, you just let us know. We can kind of work through a case. That could be maybe we'll have to come up with a new segment name.
Yeah, that would be a long one.
But I mean, well, no, we can keep it basic. Yeah, we can keep it basic and work through just, maybe like a 2-3 set question.
Because I know cases are a big part of boards.
Big part.
I want to say there's even more case-based than...
Yep.
So we'll see.
Well, that's what we're going to be doing every day. Mm-hmm. Give or take.
That's what it all is. Yeah, that's what you're putting all this knowledge into is the case.
All right. Well, we appreciate you guys. If you have not followed us or subscribed, if you're listening on YouTube, please subscribe. If you are listening to Spotify or on Anchor, just make sure you keep listening to the episodes. Follow us on there as well, so that way you can see when we post new episodes. And obviously follow us on Instagram. Obviously we the name of the podcast, Because Teeth Podcast. That's our name on Instagram, Because Teeth. We should have a website over the next couple of weeks. I'm hoping to kind of just finish that up. I'm working on that. And yeah, so we appreciate all the support we've been getting. We definitely want to get some feedback. I think at this point we've got a decent amount of episodes, out. So if you guys have any feedback for us, let us know. Anything you guys want to hear.
What you're liking, what you're not liking, any critiques, anything.
Yeah, we appreciate all feedback. So till next time, we'll be in our seminar. Next episode will be a lot of information. We'll have a lot of information for you guys. So we're excited and see you next time.
All right. See ya. Why do we do it?
Because teeth.